Hello guys and welcome back to my channel. If you are new here, my name is Andy. I'm a family nurse practitioner. Today I want to talk to you guys all about childhood asthma. So if you're interested in learning about asthma, then keep on watching. Asthma is a reactive airway disease that causes the lungs to narrow and inflamed and cause shortness of breath, chest pain, wheezing, and respiratory distress. Asthma is a very common childhood disease, and it occurs and is seen frequently in families that have history of asthma. So if a father or mother has asthma, there's a likelihood or possibility of the child having asthma, although not always the case. Also, asthma can be triggered by different things. Sometimes asthma is triggered by allergy, and it's called allergy-induced asthma. It can be triggered by exercise, and that's called exercise-induced asthma. And it could be also due to occupational exposure. So if you work with asbestos, or if you work with a lot of dust and mold, it can trigger asthma. The main goal for asthma is symptom control and management. Asthma can't be cured, but people can grow out of it. That just means that in adulthood or as they get older, some people might not have symptoms anymore or less frequent symptoms. So, although a child cannot be officially diagnosed with asthma until they are 7 years old, we are beginning to see a lot, especially in families with history of asthma. We are beginning to see it a lot in children less than 7, and they are treated exactly the same way as you would treat asthma. So with asthma, there's mainly two forms of medication: inhalers and pills to prevent allergies, because like I mentioned, sometimes asthma is triggered by allergies, so like pollens, dust, mold, things like that. So there are two forms of inhalers. There's a short-acting inhaler and there's the long-acting inhaler. The long-acting inhaler are the ones that the child will have to take twice a day, 2 puffs in the morning and 2 puffs in the evening. And those mainly contain steroids, and that's to help open up the lungs. In between that time, if the child needs another inhaler, they can use their rescue inhaler, also known as the short-acting inhalers, and that works faster to open up the lungs. Now, the child is not supposed to use that a lot, okay? So again, as the name entails, it's supposed to be a rescue inhaler. So if you see a child using that frequently, then you need to reassess their medication. Again, asthma, main goal is symptom management and control. So if you have a child that you're seeing that has asthma, they have to have appointments every 3 months for symptom check and medication refills. When you're seeing a child with asthma, you always want to ask them if they have nighttime coughing, if they're having shortness of breath or respiratory distress, how many times they have used their rescue inhalers, and if they've been to the hospital recently. So depending on the symptoms of the child can have a mild asthma, moderate persistent, mild persistent, or severe asthma. So that just depends on how often they have exacerbations, okay? So when you're seeing a child, you want to ask all those questions. If the child is having too much frequent exacerbation, you want to go back to their action plan, which is given to a child each time when they are diagnosed with asthma. So action plan basically tells the child child and parents, the things they are supposed to look for when they're in the green zone, when they're in the orange zone, and when they're in the red zone. Green zone means I'm fine, everything is good, no problems. Orange zone means I've noticed that I'm taking my rescue inhalers frequently, although I still feel kind of okay, but not quite that fine. And then red zone is danger, problems, not well controlled, having exacerbation. So depending on what's going on, you want to review the person's action plan, and especially with children, you want to review how they are using their inhalers. One of the most common reasons why a child is having frequent exacerbation is because they are not using their inhaler the right way. If you're a pediatrician, or if you're a parent and your child has been diagnosed with asthma, make sure that their inhaler is ordered with what is called a spacer. A spacer helps the child, helps retain the medication, make sure that it goes down into the child's lungs and opens up the lungs. If the child is using the inhaler incorrectly or without a spacer, most of the medication is lost into the air, so not quite enough is going into the lungs. That's why it's not working well for the child. So you want to review and actually watch the child use their inhaler by themselves so that you can see if they are using it the right way. All right, another form of medication, it's in a mist form, and it's known as or liquid form, and it's known as a nebulizer. So the child will be given a machine called the nebulizer machine, and then they'll be given the liquid form of the medication, gets put into the inhaler, and the child will use it, use it with a mask, put it on their face, and it gives out this mist that helps open up their lungs, okay? And that is to be used every 4 hours as needed. And again, the child should not be using that so often. So if the child is using that a lot, then you need to do a medication review, see how the child is using their inhalers, and see if there are things that needs to be changed, okay? One of the main symptoms of asthma is nighttime coughing, respiratory distress, chest pain, shortness of breath. If your child has exercise-induced asthma, you always want to make sure that your child has an inhaler in school. If your child is a school-age child, and your child's nurse at school can keep this for the child, but it will require your child's pediatrician or nurse practitioner to fill out a medication school form for the child and give it to the school nurse. The school nurse will have that with the inhaler, so that if there's any problems at school, the school nurse can then administer that inhaler legally to the child. If they do not have that medication form, they're not going to. So make sure that you inquire about that. Also, if your child has exacerbation, they can get what is called prednisone. It's a steroid with inhalers. They get it for a short course of prednisone to kind of open up their lungs. Sometimes they might need antibiotics depending on how bad it is, okay? Again, the goal of asthma is to prevent frequent symptoms and to control the symptoms, okay? Mainly management. Now, asthma, again, the symptoms or frequency of symptoms depends on the child and the family. And parents, it's very important that you know you fully understand what asthma is, because it can be life-threatening. If you know what it is, then you can watch out for your child and know the things that your child can prevent, which are called triggers. Hopefully that was good information for you. If there's anything you want me to talk about or to go into details about, please let me know. As usual, thank you so much, and until my next video, bye.